Now let's begin with cystic fibrosis. Cystic fibrosis is an autosomal recessive disorder in which there's deletion of CFTR gene on chromosome 7. So actually we need to understand the function of CFTR gene. So if that is not present, then what happens also we need to understand. So if you see here the diagram, the CFTR gene, this one, it controls the chlorine channel, especially it secretes chlorine in lung. You can see here this is a normal function. It secretes the chlorine into the lung, especially into the mucus. So the mucus is normal, it is fluid. You can see this yellow color normal mucus is because of the CFTR gene which secretes chlorine, and also it secretes the chlorine in the same way in GI tract, but it reabsorbs chlorine in the sweat gland. That is the function, normal function of CFTR. So if there is a deletion, there is leading to misfolded protein and improper protein trafficking, and that is leading to protein retention in rough endoplasmic reticulum, so that there's decreased chlorine and water secretion. Especially you can see this decreased chlorine and water secretion into the mucus. So the mucus is getting more dehydrated, and you can see the color change into very black. So now this mucus is very thickened and it is obstructing the airways, and sometimes this may also lead to bronchiectasis and also blood hemoptysis in our sputum, and this may also lead to respiratory failure in further more severe stages. Next, coming to diagnosis part, we can diagnose this disease by seeing increase in chlorine concentration in pilocarpine sweat test. In sweat test you can see normally, but in sweat duct it is opposite, because chlorine is reabsorbed here normally when CFTR is present. So now when CFTR is not present, the chlorine concentration is increased in the sweat gland. So that is one diagnostic feature for this cystic fibrosis. And another one is you should see increase in immunoreactive trypsinogen in newborn screening, because even the pancreatic duct is also blocked because of this same mechanism. So we need to check this too for the diagnosis. So the complications of this disease is recurrent pulmonary infection, because you can see this mucus is now settled there, it is thick and it is unable to move. So now here many bacteria and organisms are attracted, like Staph aureus and aeruginosa, so aspergillosis, all these are attracted here, and that is leading to bronchiectasis. And you can see the reticulonodular pattern on chest x-ray, and there are also formation of nasal polyps, nail clubbing, pancreatic insufficiency. Actually in this same mechanism the pancreatic enzymes are not released into the small intestine, so all the pancreatic enzymes are stuck in the pancreatic duct, so that these enzymes may attack the pancreas itself, and that will lead to pancreatitis, malabsorption with steatorrhea, because pancreatic enzymes are useful for fat absorption, but if this is not happening, there will be fat in the fecal matter. And also you'll get fat soluble vitamin deficiencies, endocrine dysfunction, liver diseases, and important is meconium ileus in newborns, because you can understand now this sputum is very thick, and now it will go into the GI tract. In the GI tract also the same problem, and the meconium will get very hard and stiffened, so the baby can't pass out the meconium out from the body, and that will lead to meconium ileus in newborns. And infertility in males, the same problem because of absence of CFTR gene. And subfertility in females, like amenorrhea, thick cervical mucus, all these are problems. Treatment is you can do chest physiotherapy or albuterol. Also, you can use some inhaled saline, so that we can somewhat loosen or make the mucus clear. You can also use azithromycin as anti-inflammatory agent, ibuprofen to slow down the disease progression, and also some pancreatic enzyme replacement therapies are used. We can also use combination of Lumaka factor or Teca factor, which corrects misfold proteins, so that we can improve this process, that CFTR can again sometime function well. We can improve that protein with also evacuate factor, which opens chlorine channels and improve the chlorine transport. So always remember, cystic fibrosis means there's a problem in chlorine. How to remember that? C for C. Cystic fibrosis, C, triple C is the mnemonic for this. That is cystic fibrosis, CFTR gene is not present, mutated, or you can say it is deleted. So because of that there is no chlorine, there's a problem in the chlorine channel, right? So because of that there's thickened, everything is thickened, mucus is thickened, pancreatic enzymes are thickened, uh, female male secretions are thickened, female cervical mucus is thickened. So that is about cystic fibrosis, and the treatment also we have done. See, muscular dystrophies. Muscular dystrophies are divided into two types: X-linked recessive and autosomal dominant. Two X-linked recessive disorders are Duchenne muscular dystrophy and Becker's muscular dystrophy. Duchenne muscular dystrophy is mainly due to frame shift deletion of dystrophin gene. So dystrophin gene is actually a DMD gene, which is the largest protein coding human gene. So what happens is when this DMD gene is launched, there is lot of loss of muscle tone in a lower limb, especially lower limb is affected more when compared with upper limb. The first thing, it starts with the pelvic bone and next it may move upward, but the most important one is calf pseudo hypertrophy. You can see here that is pseudo hypertrophy of calf muscles due to fibrofatty replacement of muscle. Actually the muscle is replaced by fibrous and fat tissue, so that is leading to waddling gait, which you can see here. And the important sign is Gower sign. Gower sign is like, as the upper limb is only good now, the lower limbs are affected, they use upper limb more to stand up. So that is seen mainly in Duchenne muscular dystrophy, that is Gower's sign. And one more thing, the onset before 5 years of age, they have dilated cardiomyopathy, which is most common cause of death in these people. Of course, if this dystrophy continues for longer period, there will be death by just 20 years of age because of respiratory and heart muscle failure. Actually, dystrophin gene, here draw a simple diagram. Dystrophin protein, actually it helps to connect muscle fibers to the extracellular matrix. This extracellular matrix primarily in skeletal and cardiac muscle. So when there is no dystrophin, there will lead to myonecrosis. This is intracellular, this is extracellular protein. This both are connected by dystrophin. If no dystrophin, you can understand there's no connection and there's myonecrosis. So the test markers to identify this dystrophies: increase in creatine kinase, aldolase, AST, ALT also will be affected, so they'll increase. So genetic testing confirms the diagnostics. You can also use PCR and Western blot techniques. Now coming to Becker. Becker is better. This is a mnemonic actually. Becker is better. Why it is better? Because this non-frame shift mutation, that is maybe a single amino acid will be changed here, but not whole the strand of the DNA, because in frameshift most of the strand is deleted. Here only single amino acid is affected, so it is not as severe as Duchenne. But here also the same thing, the dystrophin gene is deleted even here, but not large deletion. So that's why it's better. That's it. Next coming to myotonic dystrophy. As I said, it's an autosomal dominant disease. And one more thing, this is a trinucleotide repeat disease. That is CTG, CTG like this. They'll be repeated. CTG, CTG like this. So this is a trinucleotide repeat disorder. The mnemonic is also CTG. What you see in this myotonic dystrophy is cataracts. You see cataracts C. And T for taupy. Taupy is like you have early balding in males. And G is for gonadal atrophy. Of course, you have some other problems like erythemias. Okay, muscle wasting, important thing. For example, if this myotonic dystrophy patient gives shake hand, they'll be that shaking hand position only. They're unable to lift again hand back towards themselves. You can see it, difficulty releasing hand from handshake. So actually this severe myotonia here, that their muscles are very weak, so that in that particular position only they put their hand for a long time, they're unable to move it because of severe muscle weakness. Let's continue with mitochondrial diseases. So mitochondrial diseases is rare actually. It's because of defect in oxidative phosphorylation. So mainly the tissues which need more energy, like central nervous system, skeletal muscle, these are most commonly affected because there's a problem in oxidative phosphorylation. So this is divided into two types of disease. One is mitochondrial myopathy and another one is Leber hereditary optic neuropathy. So this mitochondrial myopathy, in the name itself you can see myopathy, problem in muscle. So it is divided into two types. Mnemonic is MELAS and MEREF. MELAS is where mitochondrial encephalomyopathy with lactic acidosis and stroke-like episodes. So here there is encephalomyopathy, lactic acidosis and stroke-like episode. In MERF there is myoclonic epilepsy with ragged red fibers. Ragged red fibers is very important. Why you see ragged red fibers is because of compensatory proliferation of mitochondria. Because there is no oxidative phosphorylation, so mitochondria compensate by forming a ragged red fibers. So in electron microscopy, you also see mitochondrial crystalline inclusions. Okay. Next, coming to label hereditary. So here there is mutation in complex 1 of ETC. This is hereditary optic neuropathy. In the name itself you can see, because there is neuronal death in retina and optic nerve. So this is leading to subacute bilateral vision loss, especially in young adults. And this is permanent. So it is accompanied by neurological dysfunction like tremors, multiple sclerosis like illness. Rett syndrome is found in females with MECP2 mutation on X chromosome. This syndrome appears in the age 1 to 4 years. Actually, the problem here is the children will undergo regression process. Regression is they return back again in their motor skills, verbal skill, cognitive abilities, ataxia, seizures. There's also growth deceleration, and important is stereotyped hand bringing movements. Like this, they'll bring the hand continuously. That is because of Rett syndrome. Next, fragile X syndrome. Actually, this is an X-linked dominant disorder in which there is repeated trinucleotide repeats like FMR1 repeats. The trinucleotide repeat here is CGG. CGG is a mnemonic for this disease. CGG is where you have congenital giant gonads. Mnemonic is congenital giant gonads, or you can say elongated chin giant gonads. Because here the problem is there are postpubertal macroorchidism, that is enlarged testes. There's long face with large dog, large everted ears, autism, mitral valve prolapse, hypermobile joints. All these are same. One more confusing thing is self-mutilation. Self-mutilation, you know, it is common in Lish-Nyhan syndrome, which is a defect in purine metabolism syndrome, but self-mutilation is also seen in Fragile X syndrome. And Fragile X syndrome is the second most common cause of intellectual disability. The first cause is Down syndrome. So you can see the most common inherited cause of intellectual disability. Down syndrome is actually the first most common cause. Next you get the Fragile X syndrome. Let us also discuss some trinucleotide repeat disorders. Here the first one is Huntington disease. Here the trinucleotide repeat is CAG. So here whatever the repeats are there, they themselves are the mnemonics. So for Huntington disease, CAG, C for caudate lobus involved, A is for decreased acetylcholine, G for decreased GABA, whereas dopamine will increase in this disease. So actually this affects on chromosome number 4, and this process show anticipation. What is anticipation? We already know, that is the severity of the disease increase with decreased onset of age in successive generation. That is, if someone gets disease at 40 years, their children may get disease at 20 years and their children may get at 10 years. So the age by which they get disease is decreasing in successive generations. That is anticipation, which is importantly seen in Huntington disease. CAG, caudate lobe, decrease acetylcholine, decrease GABA, increase dopamine. Next, coming to myotonic dystrophy, already we discussed. This is CTG repeating. So the mnemonic is CTG, C for cataract, T for topy, that is balding in males, and G for gonadal atrophy. So gonadal atrophy, dystrophy in myotonic dystrophy. So dystrophy, atrophy. Whereas in Fragile X syndrome, CGG, that is giant gonads. Okay, giant gonads and chin is protruding. In Friedreich's ataxia, there's GAA, gait. You can remember as gait. Ataxia in the word itself you can see. So ataxic gait. That is the problem here. And in Friedreich's ataxia, there's mutation in frataxin gene in chromosome 9. So because of abnormal frataxin, you get mitochondrial dysfunction, and that is leading to also hypertrophic cardiomyopathy. So these are the trinucleotide repeat disorders: Huntington disease, CAG, myotonic dystrophy, CTG, Fragile X, CGG, and Friedreich's ataxia, GAA. Autosomal trisomies are of three types: Down syndrome, Edwards syndrome, and Patau syndrome. So Down syndrome is because of trisomy 21. So just by simple mnemonic we can learn this syndrome. That is, drinking age is 21 years. So like that the mnemonic is alcohol and beer. So here alcohol, you can see the triple 4 times we wrote A, because the first A represents the advanced maternal age. So Down syndrome is most common in mothers who are bearing their child after 30 years. And another A is for duodenal atresia, which is common in Down syndrome. And another A is for atrioventricular septal defect, that is ASD. And the last A is for Alzheimer's disease, which is early onset Alzheimer's disease. And here H represents the Hirschsprung's disease. And here comes the B now. B for brushfield spots. You can see here brushfield spots, which are whitish spots which you can see in the iris in Down syndrome patient. And another is E is for epicanthal folds. E is for epicanthal folds. And the other is for some malignancies which are like AML and ALL. And R is for Robertsonian translocation. So these are all the features of Down syndrome. Of course, intellectual disability, flat faces, and single palmar crease, as you can see in this diagram. They have only single palmar crease like this. So all these are seen in Down syndrome, and the test we do is karyotyping and quad screen. An important thing is that the markers which are present in screening, in first trimester screening in Down syndrome, you see high levels of HCG and low levels of PAP-A, whereas in Edward and Patau syndrome, you see both beta HCG and PAP-A are decreased. Only in Down syndrome, beta HCG will be high. Next, coming to Edward syndrome, we remember like a prince called Edward, who is of 18 years of age, like that we can remember. The mnemonic is prince here. P is for prominent occiput, R is for rocker bottom feet, and I is for intellectual disability. N is for non-disjunction. Actually, you can see here this is a meiosis non-disjunction. It is seen in meiosis 1 and also in meiosis 2. If non-disjunction occurs in meiosis 1, it will lead to formation of 2 trisomies, you can see here as daughter cells. If there is non-disjunction in meiosis 2, it forms 1 trisomy in the daughter cells. So here prince, P for prominent occiput, R for rocker bottom feet, I for intellectual disability, N for non-disjunction, C for clenched fist. You can see here the clenched fist with overlapping fingers, which is especially seen. You can see overlapping fingers, clenched fist. This is seen in Edwards syndrome, which is of trisomy 18. And E is for low set ears, micrognathia, small jaw. And there's also ventricular septal defect associated with this, sometimes omphalocele, myelomeningocele. Usually these children die by age 1. So here the screening I already said, decrease beta HCG, decrease PAP-A, and decrease alpha fetoprotein. All these are decrease in Edwards syndrome. Now let us come to Patau syndrome. Patau syndrome is trisomy 13. You can remember like puberty at 13. So the mnemonic for this is all starts with P. That is, here the patient presents with cleft lip or palate. There is holoprosencephaly, there is polydactyl, there is aplasia, there is congenital heart disease. You can remember it as pump disease, and also you have polycystic kidney disease. Here also beta HCG and PAP are decreased. They are having congenital heart disease, which is you need to remember. So this example here shows the cutis aplasia. You can see here in the center how there's like pimple like structure and loss of hair. This is cutis aplasia seen in Patau syndrome, trisomy 13. Let's continue with genetic disorders by chromosome numbers. So let us start with 3. So chromosome 3 is affected in von Hippel-Lindau disease and renal cell carcinoma. So 3 for von Hippel-Lindau, and 4 is for ADPKD, which is achondroplasia, and also Huntington disease is for 4. And 5 is for Cri-du-Chat syndrome, familial adenomatous polyposis. 6 is for hemochromatosis, 7 for Williams syndrome, cystic fibrosis, 9 for Friedreich's ataxia, tuberous sclerosis, 11 for Wills tumor, MEN1, beta thalassemia, 13 for Patau syndrome, Wilson disease, retinoblastoma, BRCA2, 15 for Prader-Willi syndrome, Angelman syndrome, Marfan syndrome, 16 for ADPKD, alpha globin gene defects, tuberous sclerosis, 17 for neurofibromatosis 1, Lee-Fraumeni syndrome, 18 for Edwards syndrome, 21 for Down syndrome, 22 for neurofibromatosis 2 and DiGeorge syndrome, and X is for Fragile X syndrome, X-linked globulinemia, Klinefelter syndrome. So you can create your own mnemonics to remember all these chromosomes because it's hard to remember them as it is. Next, coming to this last three concepts. The first one is Robertsonian translocation. So first you should see this chromosomes. These are the normal chromosomes. One thing you need to know, this is a short arm of the chromosome, this is a long arm. Actually the short of the arm of the chromosome is P, long arm of the chromosome is called Q. So now what happens is in Robertsonian translocation, you can see this short arm of this orange color one is removed, and the long arm of this blue color one is replaced here. So this has come to this side and this is removed, this part is removed and this part is removed. So the short arm of orange one is removed and the short arm of blue one is removed. So you can see here this light color, this both are removed and these are replaced like this. That is long arm of orange and long arm of blue are mixed together, whereas this part of chromosome is as it is, and this one is now replaced with this, and still there is one more blue one, right? So the same, but some are lost, like the short part of blue chromosome and the short part of orange chromosome is lost. So this type of translocation is called unbalanced gamete precursor or translocation. But this kind of translocation may result to miscarriage, stillbirth and chromosomal imbalances like Down syndrome, Patau syndrome may causes. That's why in Down syndrome, if you remember the mnemonic alcohol and beer, in that beer R represents Robertsonian translocation, which may lead to Down syndrome. But the same translocation, if it is undergoing in a normal way without losing anything, without missing any gene, then that would be normal. It will not affect any part of the cell function. And these translocations are most common in between 21, 22 chromosome, 13, 14 and 15 chromosomes. So this part which we are removing, that is called acrocentric part of chromosome. You can see here occurs when long arms of two acrocentric chromosomes with centromeres, this is the N, fuse at centromere, and two short arms are lost. You can see two short arms are lost. So now coming to the deletion syndrome. So there are three types of deletion syndromes: Cri-du-Chat syndrome, Williams syndrome, DiGeorge syndrome. In Cri-du-Chat syndrome, I remember like a 5-year-old child who is crying a lot because she's very sad. Okay, so 5 years old child I said because it's involved short arm deletion of chromosome 5. Okay, short arm is, now you know, that is P part of chromosome. This P part of chromosome is gone in chromosome 5. So 5-year-old child is crying because very sad. Very sad is because VSD, ventricular septal defect, is present in this child and she is very sad. So she is crying. Crying is because crying like cat is called Cri-du-Chat. Here the findings are, the girl is having very small brain. As she is having very small brain, she have low intellectual ability, and she's high pitched crying. She's having high pitched crying and some epicanthal folds. Okay, now coming to Williams syndrome. Williams syndrome is like a 7-year-old girl who is having different facial features, intellectual disability, hypercalcemia, but her verbal skills are normal, and she's showing extreme friendliness with strangers, which is very uncommon thing for small children, but she's showing extreme friendliness with strangers. And she also have cardiovascular problem like supravalvular aortic stenosis and renal artery stenosis, pulmonary artery stenosis. So all the arteries are getting stenosed in Williams syndrome. And here the verbal skills are normal, that is differentiation between Cri-du-Chat and Williams syndrome. In the name you can see Cri-du-Chat, but there is no normal chatting here because verbal skills are decreased. But in Williams it's normal. Next, coming to DiGeorge syndrome. Here there is 22q deletion. 22 means on the 22nd chromosome. Q means long arm of 22 chromosome or got deletion. So because of this, there is immune deficiency, hypocalcemia, of course associated with congenital heart disease. So by this we complete genetics of biochemistry step 1.